Hello everyone, this is Dr. Sam and today we will discuss ultrasound appearances of spleen. The spleen is an intraperitoneal organ that is crescentic in shape and has homogeneous echotexture. And the hilum is the region where the blood vessels enter and exit the spleen. The splenule, also known as accessory splenic tissue, can be found in the hilar region or even at the lower pole of the spleen. It is an accessory splenic tissue. It is not a pathology. It can occur in some patients and it will have an isoechoic appearance, similar appearance to the spleen. And on Doppler, it can have blood supply which can be noted. Here you can see two separate splenules. They can be more than one in some cases. Splenomegaly is an abnormal enlargement of the spleen. If the length exceeds 13 centimeters and the thickness exceeds 6 centimeters, then it is termed as splenomegaly. Here you can notice splenomegaly in transverse view. You can measure the thickness of the spleen in this view. If you notice a well-defined hyperechoic line passing through the spleen, it is a splenic cleft. It is also a normal occurrence. A splenic cyst is a cyst just like in other organs, a well-defined anechoic structure and will have enhancement. Sometimes the cysts can have calcified walls which will appear hyperechoic and have posterior shadowing, but it is a very rare occurrence. A complex cyst will have internal echoes and multiple septations. A hemangioma in the spleen will appear as a hyperechoic, well-defined lesion, and it is also homogeneous. Another image of a hemangioma in the transverse view appearing as a hyperechoic and homogeneous lesion. The appearance of lymphangioma consists of multiple cysts. Here you can see a lot of cysts inside the spleen. In this image you can see multiple cysts that are connected together, which means they have a common wall. This type of appearance can also be seen in a lymphangioma. Extramedullary hematopoiesis usually involves the whole spleen, but sometimes they can be focal. When they are focal, they present as hyperechoic masses without any internal flow on Doppler. An inflammatory pseudotumor can occur in the spleen as a large heterogeneous mass. It mimics the appearances of other tumors. It is a very rare lesion of the spleen. On applying color Doppler, we will notice hypervascularity in the mass. In the normal spleen, you can see it is not as much as it is in the inflammatory pseudotumor. A lymphoma is the most common malignancy of the spleen. It appears as a hypoechoic, solid, spherical mass inside the spleen. Lymphomas may sometimes involve the entire spleen, appearing as multiple hypoechoic areas spread throughout the splenic tissue. Metastatic lesions in the spleen will appear as target lesions, which include a hypoechoic halo and a hyperechoic center. Here is a transverse view showing multiple metastatic lesions appearing as hypoechoic halos with hyperechoic centers. Metastatic lesions can also have variable appearances depending on the type of primary cancer. In this case, it is from a metastatic melanoma. Here you can see solid areas as well as cystic components in this large mass, overall giving it a heterogeneous appearance. An abscess in the spleen will appear as a complex cyst with internal echoes, and the main distinguishing feature is that there will be no flow on color Doppler. Gamna-Gandy bodies involve the entire spleen. They appear as scattered, bright, hyperechoic reflectors throughout the splenic tissue. Here you can notice these hyperechoic dots, and they are scattered throughout the spleen. Here is a transverse view showing Gamna-Gandy bodies, hyperechoic bright dots, bright reflectors without any shadowing. Granuloma in a spleen can occur in the setting of mycobacterial infections and histoplasmosis. They appear as multiple hyperechoic calcifications scattered throughout the spleen. Another case of granulomatous infection of the spleen presenting as multiple calcifications throughout the spleen. The appearance of sarcoidosis can mimic other types of appearances such as of lymphoma. That is why these need to be clinically correlated. They appear as hypoechoic nodules in the splenic tissue. The spleen is prone to injury in the setting of blunt trauma and often present with free fluid which is anechoic due to fresh blood, and it can also have heterogeneous or hypoechoic areas referring to hematomas. Here you can see a subcapsular hematoma in the setting of trauma to the spleen. It is filled with heterogeneous areas. Sometimes an elongated left lobe of the liver can reach the area of the spleen and can come in the field of view. This can mimic a hematoma. Here is the liver actually, it is not a hematoma, and we can distinguish it by using color Doppler. The liver will have internal flow, whereas the hematoma will not have any flow. Here is an image with color Doppler applied. You can see blood flow inside the liver. This type of condition is called Pseudoperisplenic Fluid. Splenic infarcts appear as wedge-shaped lesions and also give a coarse appearance, coarse echo texture of the spleen. And when we apply Doppler, there will be absence of flow due to infarction. Here you can see splenic infarcts appearing as wedge-shaped regions inside the spleen. Splenic torsion will also give absence of flow on Doppler. It can also lead to infarction. Here you can see infarcted splenic tissue, but the main distinguishing feature is its location. The spleen will not be in its original location. It may be located in the pelvic region or in another location in the abdominal cavity. Aneurysm of the splenic artery will appear as a cystic structure in the hilum of the spleen. In this image we have applied color Doppler and we can see internal flow in the aneurysm of the splenic artery. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.